It took 5 decades for scientists to come up with a viable vaccine for polio, and 11 months for Israel's war on Gaza to create the conditions for the disease to spread once again. I'm Anelise Borges, and on this episode of The Stream, we look into what lies beyond the visible devastation of Gaza, an emergency as deadly as the bombings. With 1.9 million people displaced, 70% of water and sanitation infrastructure damaged or destroyed, and only a third of the hospitals operating, public health in Gaza is a ticking time bomb. Add to that the resurgence of diseases that had been almost eradicated, like polio, and you have a full-blown catastrophe in the making. On Friday, Israel agreed to allow children in Gaza to be vaccinated and says it has opened humanitarian corridors for medical teams and supplies to go in. But for the campaign to be effective, the World Health Organization says 90% of all children would need the vaccine, and that only under a ceasefire could a program of that scale run safely. To discuss, we have joining us today Dr. Sanjay Adusumilli, a general surgeon, co-founder of the charity Global Medical Foundation Australia, Dr. Nabeel Rana, a vascular surgeon and member of Humanity Auxilium, and Yara, the co-director of the Palestine Program for Health and Human Rights. Thank you all so much for your time today. Thank you for joining us here on The Stream. We've been talking about the collapse of Gaza's healthcare system for a while now, but what does that mean on the ground? Dr. Nabeel, you spent 3 weeks volunteering at Al-Aqsa Hospital. Can you tell us what you saw?
Yeah, I mean, the first thing I say is that it's very difficult to describe in words from seeing the pictures and videos for when you actually arrive there and witness with your eyes and ears. The medical infrastructure has been almost completely eradicated, and whatever is left there is functioning at a damage control level. So when I arrived at Al-Aqsa Hospital, which unfortunately, as you know, has been recently evacuated, it was only one of maybe 3 hospitals that could serve the purpose of a trauma center and major healthcare. And besides that, almost all the other facilities had already been closed. And since I left, multiple other facilities have closed. So you don't have really facilities or infrastructure that's available. And then within those facilities, there's a dwindling supplies, equipment, almost to zero. So even if you're there and you have some staff there, you have very, very limited equipment and supplies to actually do any work with.
The picture that you paint is absolutely hopeless. I mean, Dr. Sanjay, based on what Dr. Nabeel just said, but also based on your own experience volunteering in Gaza, this is a population that is extremely vulnerable, but also a medical corps that is exposed to the same risks as the civilians.
That's correct. So I worked in the same hospital as Nabeel, and what I'd probably add is that hospital actually isn't designed to care for victims of war. It was actually a maternity hospital. So it was essentially a makeshift hospital, and it was one of 3 functioning hospitals that were remaining. And it was filled with probably about 1,000 people, patients who are unwell, and now they've all been shifted out into the streets. And we're going to see a huge, unfortunately, a drastic number of deaths as a result of this. And people have essentially nowhere to go. I'm being contacted by doctors who are there at the moment who are walking the streets trying to find a place to live because they've been evacuated. They don't have anywhere to stay. They don't have fresh drinking water. So it means that the population is crowded, including the healthcare workers, which also means that disease is going to spread very rapidly.
And the reason why we decided to do this show, one of the reasons, was because of the resurgence of polio. And Yara, in terms of the broader implications of the collapse of infrastructure and its links to the resurgence of diseases, as we said at the start, 70% of water and sanitation infrastructure was either damaged or destroyed. Can you tell us what this means in practical terms for people there?
Yeah, absolutely. I mean, what we're seeing and what we've seen since October is an absolute attack on every aspect needed to sustain life. Roads, more than 90% are destroyed. Almost no water and electricity available. People we've seen drinking puddle water, looking through trash to get food. As the physician said, we have a completely collapsed healthcare system that is only minimally able to attend to trauma wounds, which are coming in by the dozens every day. And so we have this kind of perfect recipe for infectious disease outbreak, which physicians and public health experts were warning about, again, as early as October. When you couple that with overcrowding, people who are being displaced 8, 10, 15 times. You have families separated. You have many unaccompanied children. People cannot leave. We've seen all these campaigns online, people raising money, trying to get to Egypt. And it is just an utter catastrophe in terms of public health. Everything that you would want as a mother, as a father, as a parent to protect your child is completely unavailable. And we warned, just as we saw in Syria less than a decade ago, of a potential polio outbreak as a result of these conditions. Gaza has not seen a case of polio in almost 3 decades. We knew that what we were seeing in October, November, December was heading in this direction. And so as shocking and horrifying as it is, it's unfortunately not surprising.
Yeah, Gaza had not seen a case of polio in almost 3 decades. And here is a heart-wrenching testimony of what the return of polio means to one family.
من قيمة شهرين ابني صابه سخونة واستفراغ مستمر وبطل يمشي وبطل يتحرك. رجعت فيه لمستشفى الشهداء الأقصى. مستشفى الشهداء الأقصى ضلوا على مضادات حيوية لمدة 2 أسبوعين وأخذوا منه عينة على الأردن. بعد 2 أسبوعين اتصلوا علي حكوا لي إنه ابنك مصاب بشلل الأطفال. كانت صدمة إنه ابني ليش والوحيد بين الأطفال وكيف ومن وين إجا وهيك، وصابني يعني هوس بهذا الإشي إنه كيف عبود صاب هذا الإشي. حكوا لي السبب إنه عبود ما خدش التطعيمات، هذا كان سبب أولي، والنزوح المستمر من منطقة لمنطقة هي اللي كانت عائق إنه نعطيه التطعيم. ابن عبد الرحمن كان طبيعي وطبيعي جدا، وفي فيديوهات عندنا بالجوالات وهو بيزحف وبتحرك وبمشي وذكريات لهذا الإشي. إن شاء الله عبد الرحمن يرجع زي قبل. هي سيئة يعني مش نضيف يعني قد ما تنظف إيش بدك تنظف في الرمل وبالخيمة بالمجاري اللي برا عفوا وبالحمامات اللي عاملينها من الناس. المكان كله مش صحي. البعوضة بتقرص في الولد ليل مع نهار. المية مش مفيدة، الأكل مش مفيد. انصدمت إنه عبد الرحمن هو الطفل الوحيد وكيف انصدمت بأولها. بعدين حاولت أتأقلم، مش قادرة أتأقلم.
It's just so hard to imagine what this mother is actually going through. It's very difficult to put into words. And Dr. Nabeel, polio mainly affects children under the age of 5. It invades the nervous system. It can cause total paralysis in a matter of hours. It is extremely dangerous, and it's definitely something that the children of Gaza can simply not afford now.
That's right. I mean, this is catastrophe over catastrophe, and this is just the latest development. And it's unfortunate because with any kind of epidemic disease in a healthy system, a healthy medical system, it's difficult to control these things. And we're working from way, way behind the ball here, where everything's already been devastated. And now you're introducing these epidemics and devastating diseases to deal with, which can't be dealt with. And, to Dr. Sanjay's point, I mean, these hospitals are not designed to provide the services that they're expected to provide right now because there's no other choice. And can they do it effectively? Absolutely not. But everyone's doing the best they can. And it's not just the trauma. I mean, we're focusing on trauma. And as a surgeon, I mean, we were dealing with that every single day, taking patients to the operating room, dealing with injuries, families being destroyed. But even on the days that there wasn't a mass casualty event, it was still extremely busy in the hospital because now you're serving this massive displaced population that's really making the hospital just bust at the seams. I mean, it's overburdening the system even further. And these populations have been constantly displaced, herded, and gathered more and more into concentrated areas. Like you're saying, almost 2 million people into a tiny swath of land with very inadequate hospitals and facilities. So to treat these kids we're still doing damage control on the trauma side, but the actual medical care is absolutely catastrophic. There were diseases on a daily basis, easily treatable, that people are succumbing to and dying from. And polio being just the latest of those. I mean, for kids, this is absolutely devastating. But it goes from kids to adults and at every population. And to try to contain this at this point is, again, everything is just damage control all the time there.
As you said, it's not just polio. Other conditions such as scabies and hepatitis are spreading very quickly. Dr. Mohammed Sabeh, who was a guest here on the stream before, was diagnosed with hepatitis after volunteering in Gaza and had this to say about how he felt.
I feel so horrible. I feel like a truck hit me. And I can't imagine how people in Gaza are able to endure all this with no comforts of a hospital bed or medications.
Dr. Sanjay, we talked a little bit briefly about this at the start, but I wanted to get a more concrete view on just how dangerous and how difficult it is for doctors and nurses to treat patients under the current conditions.
It's a lot of pressure. And look, it's devastating to see pictures like this where you have healthcare workers who are unwell and you see children who are affected by all of this. It's near impossible, and it has a big impact on the mental health of the healthcare workers because there's only so much you can do. And in front of your eyes, you see patients dying from trauma, you see them dying from medical conditions, you see them dying from malnutrition. And just as Dr. Nabeel said, there's such a huge amount of malnutrition currently in Gaza, with 30% of children malnourished, which means their ability and to be able to fight things like polio and hepatitis is virtually zero. So you just need a simple virus such as any of these to tip these poor patients over the edge, leading to death. And I really feel that as a society, we're doing very little to help with this because patients are dying left, right, and center, and the vast majority of them are children.
It is a war on children, right? Sometimes it's difficult not to conclude that. On the fact that this is very much a man-made catastrophe, Mazen Laban posted this on X. He said, infectious disease epidemics almost always follow famines. Gaza is heading towards a threefold genocidal calamity of mass murder, deliberate starvation, and lethal epidemics. Yara, what about the importance of understanding that this is not some casual occurrence, that polio didn't simply appear?
Absolutely. And before I respond, I want to reiterate the legal reality that Israel, as the occupying power, remains responsible for the health of Palestinians. So we keep hearing these reports of, humanitarian agencies trying to get in, requiring Israeli permissions. This is not Israel doing the Palestinians a favor. This is Israel's legal obligation. Now, for months, as you said, the World Health Organization has been tracking infectious diseases from relatively mild, what we would consider mild in a functional health system like lice and scabies, to influenza, COVID-19, tens of thousands of cases of skin rashes, many of which are unidentified, more than 1 million types of respiratory infections. We saw that this summer was among the hottest recorded in the region. So there's all of this threat from, mosquito-borne and other animal vectors. We have trash and sewage sitting outside. And we're only seeing what's reported. So there's a untold, burden that are for people who are in unreachable areas where they're not able to go to medical facilities. And the saddest part is that, especially with something like polio, we know how to prevent this. This is not inevitable. This is not a unfortunate, reality of war. This was entirely predictable. And when we think about what causes people to die from war, yes, we can look at the bombs, we can look at the snipers, and we should. However, in the reality, looking at the history of warfare, more people die from indirect deaths, from infectious diseases that are untreated, from malnutrition, as we're seeing, and famine, which has been reported as far back as March as a risk, from maternal and infant mortality. We've seen rates of stillbirths and abortions of up to 300% more. And this is data, again, from earlier in the spring. It's undoubtedly much worse now. We're to the point where we were agitating for a ceasefire, and we're to the point where a cessation of violence this minute, which I fear is not close, will not stop this snowball of this health catastrophe that is starting to unravel, and will require a humanitarian intervention that we have not seen yet.
And it's a combination of so many factors and so many violations of international law that is just, again, really hard to fathom how we're still having this conversation 11 months on. Dr. Nabeel, I want to have a sense on, not on official data, but the percentage of people that you treated, because I was reading an estimate of at least 50,000 children have been born in Gaza since the start of this escalation of the war, since October last year. In terms of the people that you treated and the people that you saw perhaps, I don't know, lose their lives, what is the percentage of that was children?
During my time there, I think the vast majority, at least half, were young children, and we saw young adults, young men and women as well. I made the point that we saw fewer elderly people because I think they just weren't able to escape the rubble and survive the initial assaults. But the children were seen in every single aspect of attack. Unfortunately, I was there when a school was attacked, and a large group of children came in. Several of who were killed, and several we had to take to the operating room and didn't survive. But even in every attack in residential areas, you understand these are large families living together, and so you attack a home, inevitably there's going to be children in there. There's going to be families destroyed. So every single person you interact with has lost part of their family in every single one of these attacks. And these kids are suffering from direct trauma. We can't even fathom the emotional trauma that's going to result from this for generations to come. And then the disease aspect, like I'm saying, this is something that really can't be captured. To Dr. Yara's point, I mean, we have numbers and estimations based on previous conflicts and what we found after the fact. But having been there, I mean, there is no way to assess what's happening in these camps because, number one, people are constantly moving and being displaced. They're in areas that you can't even reach. They can't reach you. They can't come to the hospitals and medical facilities. There's no transportation, no roads. They're scared to death because being out in general is a risk to your life anywhere, even in the safe zones, which has been proven. The night I arrived there, I witnessed a missile attack in a safe camp in Mawasi. And so immediately I realized there's no such thing as any safe area here. So I'm very concerned with this vaccination program where what I heard, I think, I'm not sure if it's confirmed, that it's going to be 2 days or 3 days of pause for 12 hours. And there's no way that you can reach or even capture where all these people and children are. And there's no way you can expect them to come to you to get vaccinated in this kind of circumstance. So I understand this is the best that can be done, but understanding that no one should feel content that, oh, this is going to be handled. It absolutely cannot be handled in an efficient way. And to the point of, when we talk about what's the actual effect and casualties and mortality, morbidity of a genocide like this, I think in the Lancet was the first time someone actually put a number estimating, I think, 180,000 deaths as opposed to 40,000, including all causes. And I think anyone that's been there will say that's probably grossly, grossly underestimated as well. I can tell you personally, I as many surgeries as I performed for trauma, I performed, and I think this is before and after I was there, I think this is across the board, there were more amputations performed for untreated diabetes and skin infections than for actual traumas. And we know how many were performed for trauma. And so these are numbers that can't be captured and are not really realized. And I'll go so far as to say this wasn't just predicted, but orchestrated. I mean, this is a created environment of herding people together, you've destroyed any kind of water sanitation, you've destroyed sewage. You can't provide fuel or wood for even just for cooking, which is an important factor in preventing hepatitis. And then you destroyed the entire medical facilities, destroy the ability to reach those facilities. There's absolutely no medical aid or equipment or minuscule coming into the hospitals. As a aid worker myself, I was restricted from bringing any kind of medical equipment or supplies to help these people. And so all of this is really designed to end in one result, which is where we are here. This is all, calculated, orchestrated, and there's been absolutely nothing done to prevent this from happening. And I would say not only has it been allowed to happen, but it's been actively designed.
Dr. Sanjay, I mean, we're all witnessing a combination of factors apparently designed to make Gaza unlivable for the next, I don't know how many years. You know the place, you know the people. How does that make you feel? And what would you like to see happen right now? I mean, Yara mentioned this, even if there was a ceasefire today, which we're not even close to that, these deaths would continue to happen. What would you like to see happen right now to give Gaza and the people of Gaza a small chance?
Yeah, look, it's horrible. I get messages on a daily basis from doctors and medical students and nursing staff at Al-Aqsa, or where they're originally in Al-Aqsa. And every day I fear for their safety. Every day I have concerns that they're not going to be messaging me the following day and something's going to happen. I have a very close friend who's a surgeon who's been displaced from living under a building with his elderly parents, and he's now walking on the streets trying to find a place to stay because it's completely overcrowded. He's developed hepatitis. He's got no water to give his parents who are in their 70s. It's horrible thinking about this, and horrible to even imagine someone going through this. And they're such beautiful people, absolutely beautiful. It brings tears to the eyes. And what's so sad is just outside the border, there's hundreds of trucks filled with medical aid that aren't getting in. And it's going to make such an impact to let them through. And I just can't understand why you would restrict all of this stuff from getting in to help all these innocent victims. And essentially what a lot of Western countries and countries with power should be pushing for is an immediate ceasefire and humanitarian workers to go in, for medical aid to go in, for food and fresh water to go in, which are all the basics for survival that these people are entitled to.
Yara, you agree? Final word here on a call to action, perhaps a message to the world today?
Absolutely. I agree with everything my colleagues have said. You mentioned the word unlivable, and I want to remind the audience that in 2012, the United Nations wrote a report that said Gaza would be unlivable by 2020 based on the current conditions made by the blockade, the Israeli blockade. So what we're seeing is an acceleration, an exacerbation, but it is unfortunately nothing new. Gaza has been living under unacceptable humanitarian conditions since 2007 and before. And when we're seeing today violence escalating in the West Bank, land seizures and home demolitions at record highs, Israeli ministers openly celebrating and encouraging events to settle in Gaza once all the Palestinians are gone, I think we need to start seeing this in the entirety of what is happening. What has happened post-October 7th is a catastrophe for all the reasons we've laid out today, and for many others we simply don't have the time to. But it is unfortunately just the continuation of what Israeli policy towards Palestinians has been. And that is the root cause of this. And Palestinians will not know liberation, health, justice until we are willing to deal with that root cause.
I don't think Palestinians or the rest of the world will know justice if we don't address this particular issue right now. Dr. Sanjay, Dr. Nabeel, and Yara, thank you all so much for your time today. Thank you for being part of the stream. And thank you all for watching. Don't forget to stay in touch with us on social media. You can use the hashtag or the handle AJStream to send us your questions and suggestions. Take care, and I'll see you soon.